From New York. I'm an attorney, and I advocate for patients with long-term disability claims for several years, and I've been on this committee since 2006.
Good morning. My name is Dane Cook. I'm at the University of Wisconsin in Madison in the Department of Kinesiology. That's the exercise sciences, and I'm interested in the psychobiology of fatigue and pain.
I'm Ron Glaser. I'm the head of the Institute for Behavioral Medicine Research at Ohio State University Medical Center, which has about 20 faculty in our group. I work most closely with my wife, Janice Kiko Glaser, who's a clinical psychologist. I'm a tumor virologist. I work with Epstein-Barr virus. Been interested in latency, viral latency for many, many years, and nasopharyngeal carcinoma for many, many years. And so we approach looking how stress affects different aspects of the immune system and how the virus story part of that fits into that. And just want to mention that I think I've been working with Nancy Klimas and Galen Marshall for many years, and actually published my first paper on chronic fatigue syndrome back in 1988 with a guy down at the CDC, Jim Jones. And so I have a continued interest in chronic fatigue syndrome.
My name is Arthur Hartz. I'm from the University of Utah, where I'm the Director of Health Services Research at Huntsman Cancer Institute. My research interest is to identify patient factors that are associated with the prognosis of chronic fatigue, and also interventions that alter the course of chronic fatigue.
Good morning. I'm Eileen Holderman. I'm a patient advocate from Galveston, Texas. I've been a trustee for the New Jersey CFS Association, making contributions mostly in media relations and public policy.
Wow, what a group. This is very impressive. So just going around the table, you hear themes of research, policy, advocacy, behavior, treatment, health services, prognosis, and then ultimately communication. So these are critically important issues and a true public health issue in its broadest sense. I also am very respectful for the tremendous expertise and experience of my colleagues here, because I think many of us have tackled issues in public health where we started. We did not know the basics of what the issues were. We did not know anything about etiology or causation of certain conditions, but it was the commitment of people like yourselves who were determined to take these issues on behalf of patients and really show perseverance to the cause over years. We know that if we do that in this condition, we're going to make a difference in the long run and hopefully in the short run. So these are all themes that resonate with me as a clinician, as a researcher, and now as a Assistant Secretary for Health. So again, thank you for being part of this, and we're hoping that this new administration can work more closely with you on chronic fatigue syndrome issues as we move forward. So I think today's meeting is particularly interesting in that we have some public testimony, so we're going to be eager to hear about that later on. We have some issues about the charter to be renewed. We're going to do that, and there are some logistic issues to renew that charter, which is set to expire this fall, but we are committed to continuing the momentum here. And then I really want to thank Dr. Wanda Jones once again. In fact, can we give her a round of applause here? I think I have lost count how many times she has come to brief me in my opening months about the importance of this committee and about the importance of this issue. So Wanda has been our lifeline. And then I had a lovely phone call with Dr. Snell last week in anticipation of today's meeting, and I really want to thank him for his service and for stepping up as the new chair. I think he deserves a round of applause, too. Thank you. What I'd like to do with you moving forward in future meetings is to keep connecting with you. I want to come to as many advisory committee meetings as possible. I'm looking forward to the XMRV meeting this fall, and then the State of the Knowledge meeting next year, sponsored by NIH. I'm looking forward to reviewing the science with you and seeing if we can better define etiology and then how we can ease suffering for people who are living with this condition. I also know that you and your predecessors have done a lot of work in putting these recommendations together, and Dr. Jones has not let anybody forget about that. And she and her staff, Mahek Nair and others, have put together this grid of recommendations. So for the next meeting, I'd like to review some of these with you and try to move on some of these with you, because I know that not only you, but the other 150 or so advisory committees to the department put in a lot of time and energy to these recommendations. Some of them, of course, have resource issues or logistic challenges, but others we should be able to move together if we have the commitment. So I want to review these with you next time and see if we can get some traction, because I know the time and energy that you put into putting these recommendations forward to me and the Secretary. And then finally, I do want to say the Secretary, I think you all have seen her in action in her first year, addressing incredible challenges with H1N1, with Haiti, and then being a leader in making health reform now a reality. And I think the passage of health reform is going to make our health system a true health system, perhaps for the first time ever. And I think it's a very, very exciting time for the country. It's an incredible time for the department. We are heavily into implementation on literally dozens and dozens of fronts. We want to improve patient care and focus more on the medical home. We want to have added emphasis on prevention, taking care of the whole patient, and then also building public health so that people don't become patients in the first place. These are all the themes of health reform that I am thrilled to see as the Assistant Secretary, and I know the Secretary has a tremendous commitment to this. And here are all the things that she has helped make happen in the first year. So based on this meeting today and moving forward, I'm eager to brief her on your behalf, and then hopefully have her come see you in the near future. So maybe I'll just pause there, and I can stay for another maybe 20 minutes or so. Maybe I can take some Q&A a little bit. Dr. Snell, is that okay?
That would be great. Yeah, we really appreciate that.
And